This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm an emergency critical care veterinary specialist and toxicologist. Thanks for joining us. Today, we're going to be talking about hairballs. You're probably wondering why we're talking about this on the ER Vet Show, but I see a lot of emergencies for cats coming in for hairballs that actually need surgery. So we'll be right back after these messages.
Has your pet ever suffered from digestive issues, anxiety, or joint pain? We want to address these issues and more with high-grade CBD oil from Alpha, made specifically for your furry friends. Using Alaskan salmon oil as a carrier, Alpha Pet's 500 CBD oil is lab-tested for quality, consistency, and safety. Plus, we are giving Pet Life Radio listeners 25% off and free shipping with code PL25 for a limited time. So visit myalphacbd.com/dogs now. That's myalphacbd.com/dogs. Because your furry friends are family.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Not only am I an emergency critical care specialist, but I'm also a cat owner. And so I know what it's like to listen to your cat hacking up hairballs. I always joke that the best alarm clock setting would be the sound of a cat vomiting, because I always jump out of bed to go find it. Now, as an emergency critical care specialist, I see a lot of cats coming in to the ER vet for vomiting. But I'm always amazed how tolerant we cat owners are when it comes to vomiting. Here's my basic rule. If your cat is vomiting then once or twice a month, it's not hairballs, okay? Cats should not vomit more than once or twice a month. And if it's more than that, you need to get to a veterinarian. If you vomited once or twice a month, or if your dog vomited once or twice a month, I can guarantee you probably get to your medical doctor or to your veterinarian sooner. But for some weird reason, we cat owners seem to tolerate vomiting a lot more. So, what exactly is a hairball? You guys have seen them. They're those big wads of ingested hair that cats vomit up. Sometimes it's an inch long. I've seen them several inches long. And typically, they're the color of your cat's hair coat, or they better be. They're usually dark due to that green bile color. And keep in mind that hair is made of keratin, the same exact thing as your own hair or your nails, and it's non-digestible. So the acid in your cat's stomach isn't going to break it down. This is really important because keep in mind that if it's not broken down in the intestinal tract, it could potentially get stuck somewhere in the gastrointestinal tract. So, why do cats get hairballs? If you've ever let your cat lick you, you'll notice that it kind of hurts. Your cat's tongue has really sharp barbs, and the reason why they're there is to help your cat groom and stay clean. Remember, we don't typically ever need to bathe cats, and that's because cats love to stay fastidiously clean. That's because they're going to groom. They're going to groom their hair constantly, and when they do that, especially if you're not brushing them frequently enough, then they're going to get all that hair stuck in the gastrointestinal tract. Thankfully, most of the time they defecate it out, but in severe cases or in cases if you have a long hair or a medium-haired cat, those hairballs can become so big that they become concretions or almost rock-hard hairballs. The fancy medical term for this is a trichobezoar, in other words, a hairball. Sometimes, though, it needs endoscopy or surgery to remove it. Endoscopy is when we anesthetize your cat and slide a really expensive camera down the mouth, into the esophagus, into the stomach, into the first part of the intestines. And sometimes we'll try to pull the hairball out that way. Unfortunately, the endoscope can only go so far. It usually can't get past the first couple of inches outside of the stomach. And for that reason, if your cat has a hairball further down in the intestinal tract, your cat may rarely need surgery. So, what do you do if your cat is vomiting more than once or twice a month? I want you to get to a vet. And the main reason why is we have to make sure that your cat's vomiting isn't due to other underlying medical problems. This is especially important as your cat becomes middle-aged or older. In other words, over 7 to 9 years of age. That's when we'll start to see more medical problems. So, what medical problems cause vomiting in cats? Most of them are metabolic or endocrine problems. In other words, something wrong with the organs or the hormone control in your cat. The biggest problems that I see in the ER vet are kidney disease, diabetes mellitus, pancreatitis, or even an overactive thyroid gland called hyperthyroidism. These are really common in older cats, and that's why it's so important that you bring your cat to a veterinarian if you notice persistent vomiting or other symptoms like excessive drinking, weight loss, or bigger clumps in the litter box. Your veterinarian is going to want to do a thorough physical exam and other tests to rule out medical problems. Now, do I do all these tests and a mandatory physical exam just because my cat vomited once? No, I don't. But again, if it's chronic vomiting more than 1 to 2 times a month, it may be more than just hairballs. So, what are some of these tests that we're going to do? In a previous episode of ER Vet on Pet Life Radio, we interviewed fellow criticalist Dr. Garrett Pachtinger on different blood tests that we do in the ER. So make sure to check out that episode. But some of the tests that we're going to do include a thorough physical exam. That's where I'm going to feel for the size of the kidneys. I'm going to feel how big your cat's bladder is. You may see me palpating your cat's neck area, which is where the thyroid nodule is. I may do a fecal test, especially if your cat is young, is indoor or outdoor, or likes to hunt a lot, because I want to make sure it's not any kind of gastrointestinal parasites or worms. Other blood tests include a complete blood count. That's where we're going to look at the white and red blood cells and the platelet function. I'm also going to do a biochemistry panel. This is the most important test. This is going to look at the BUN and creatinine, or the SDMA. These measure kidney function. I'm going to look at the liver values, the salt balance, the blood sugar, the protein. I also want to do a urine sample. It's really hard for pet owners to be able to catch a urine sample at home, especially with a litter box. But this is something I often will collect with a sterile needle. And the main reason why I do this is because I want to look at how well your cat's kidneys can concentrate and to make sure there's no crystals or infection in the urinary tract. I oftentimes will do a T4, or what I call a thyroid hormone test. I never do this in cats less than 6 years of age, but in cats greater than 7, this could be a treatable cause for the vomiting. In severe cases, I'll do x-rays or ultrasound if I'm worried that there could be other underlying problems going on, like a hairball stuck in the intestines, to make sure that your cat doesn't need surgery. We'll continue with this really important topic right after these messages from our sponsors. Hi, Dr. Justine Lee. Do you know what I love? My cat, Lola. What I love about her is whenever I take a nap or go to sleep, she always wants to snuggle right up against me. You know what I don't love? Cleaning up after Lola's litter box, which is why Arm & Hammer created new cloud control litter. There's no clouds of nasties when I scoop. It's 100% dust-free, free of heavy perfumes, and helps reduce airborne dander from scooping. So what happens in the litter box stays in the litter box. New Cloud Control Cat Litter by Arm & Hammer. More power to you.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. We've been talking about the really common problem, hairballs. We cat owners typically blow off 1 or 2 episodes of vomiting. But when does it become an emergency where you actually have to bring your cat into the ER for vomiting? My general rule is if your cat has vomited more than 6 times in a row in a 24-hour period, you should get to a vet. If your cat is showing signs of listlessness, they're hiding, they're lethargic, they don't want to eat, you need to get to a vet right away, especially if your cat's not getting any better. If your cat is chronically vomiting, you typically don't need to go into the ER vet, but you should go to your regular family veterinarian. And again, for me, vomiting more than 1 to 2 times a month is not just hairballs. It could be an underlying problem. So again, we want to make sure to rule out problems like an organ problem, like kidney disease, an endocrine problem, like an overactive thyroid or diabetes. Sometimes a dietary change can help treat some of these underlying hairball episodes. But again, we just want to make sure it's not an underlying medical problem. Now, what if all these expensive tests come back normal? What are some other rule-outs or causes for increased hairball vomiting? Well, sometimes it can be from increased hair ingestion. Now, I know that makes sense, but if your cat is excessively grooming, this can actually result in an older cat all of a sudden getting more hairballs. I will get on my little soapbox and say, if you have a cat, you should be brushing them at least once or twice a month. So my general rule is put it on your Google Calendar so it always reminds you to do it. And while you're watching TV, please take the time to brush your cat. Your cat doesn't want to have a really dull or flaky hair coat. And they really appreciate the feeling of being groomed because it helps them feel clean also. Now, with certain medical problems like skin or hair coat problems, we can see cats grooming more, and this can increase the risk or the prevalence of vomiting up hairballs. Certain types of skin disease like food allergies, fleas, skin allergies, or ringworm can cause your cat to groom more, and again, result in more hairballs. Problems with the gastrointestinal tract can also cause an increase in vomiting. If your cat has worms, cancer of the intestines, abnormal contraction of the intestines, we can see more hairballs. Sometimes behavioral problems can cause this too. Maybe you just moved, your cat may be stress grooming or having a compulsive behavior where they're grooming more. Or sometimes if a cat is really bored, they'll groom a lot. Musculoskeletal problems like severe arthritis or joint disease. Your cat can't tell you, hey, I'm painful. And instead, they may excessively groom over the hips or the back area as a result of pain. Sometimes it could be pain in the abdomen, the belly, or in the bladder that also causes excessive grooming. So you always want to check with your veterinarian, especially if a dietary change or an increase in grooming doesn't help remedy the situation. Now, my simple test that you can start at home, please brush your cat more. And I will say that even though I have short-haired cats, sometimes I groom them and I actually clip them down to a lion cut. The main reason why is because they shed excessively and I don't have time to brush them a lot. So sometimes I will take them to a groomer or I'll groom them myself in the vet clinic and I'll actually clip them down. This is especially important if you have a long-haired cat like a Persian. Taking them to a groomer during the summer can help reduce the risks of hairballs. I personally also think cats like to walk around naked with less fur on. The second thing you can do is switch to a high-fiber diet or add a hairball remedy medication. These are over the counter. You can buy them at a pet store. And sometimes that extra fiber or lubricant can help pass hairballs down without any problem. Keep in mind, though, if you're brushing them more, you've tried the high-fiber diet, you've tried the hairball remedy medication and it's not working and your cat is still vomiting more than 1 to 2 times a month, you have to heed the side of caution. Get your veterinarian to be on the safe side. Think of it this way. Again, if you vomited once a week for years, wouldn't you go to your medical doctor? Same exact thing. If your cat is vomiting more than once or twice a month and that food trial doesn't cure it, it's worth talking to your veterinarian just to make sure that it's not something else besides a hairball. We always want to play it safe to make sure we keep our feline family members safe. Last important consideration, coughing up hairballs can rarely be feline asthma. If you Google what a cat sounds like when they're coughing from asthma, you may notice that it sounds really similar to a cat just, quote, hacking up hairballs. Rarely, your cat may actually be having difficulty breathing, and that hacking sound is actually an asthma attack. When in doubt, please take a video with your smartphone, take it to your veterinarian, and make sure it's not this rare, life-threatening problem. So, feline asthma is one rare, similar problem that sounds like coughing up hairballs. When in doubt, let's keep all our cats safe and minimize the discomfort of frequent vomiting and keeping them more comfortable by grooming them, making sure they're on an appropriate diet, and most importantly, that they don't have an underlying medical problem that's actually causing them to vomit more. Well, that brings me to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me your pet questions at drjustine@petliferadio.com. You can also Facebook message me if there's any topics you want to hear on ER Vet on Pet Life Radio. With that, we're out of time, and we want to thank our producer, Mark Winter, for making the show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.